After a long time, we are going to discuss today our of the topic, which is allergic conjunctivitis, which is most commonly seen. So let's start. So what is conjunctivitis? Itis means inflammation of conjunctiva. So some allergic or hypersensitivity reactions will leads to allergic conjunctivitis. They may be humoral response or delayed response. So what are the types? There are mainly 6 types. One is simple allergic conjunctivitis. In that we have seasonal and another one is perennial. So we have VKC, AKC. VKC means vernal keratoconjunctivitis, atopic keratoconjunctivitis. GPC is giant papillary conjunctivitis, plain tenular keratoconjunctivitis, contact dermatoconjunctivitis. So let's start. So simple allergic conjunctivitis. In that patient will be complaining of itching. So itching means and hyperemia. Hyperemia means increased blood supply and mild papillary response. So it may be acute. Acute means less than 2 weeks onset, or subacute in between 2 weeks to 12 weeks in between onset, and it is an urticaria reaction, means some allergic reactions will be seen all over the body. So coming to etiology, it is type 1 hypersensitivity reaction, IgE antibody mediated, and mast cell activation. These IgE antibodies go and attached to the Fc portion of Fc receptors which are present on the mast cell. So that mast cell gets activated and release of histamines or serotonin. These occurs. Okay. Exposure of ocular surface to airborne allergens, and some patients may complain of family history. Some patients with family history of atopy. Okay. And coming to simple allergic conjunctivitis. So this is one type of simple allergic conjunctivitis. We are going into seasonal allergic conjunctivitis. So seasonal allergic conjunctivitis means in particular seasons some person will get conjunctivitis. So due to the it is due to the response to seasonal allergens. Okay, like tree and grass pollens. Okay, grass pollens, like that. So it is associated with allergic rhinitis. We will call this as hay fever. Okay, hay fever, and it manifests as acute allergic conjunctivitis. Okay, coming to second one, perennial allergic conjunctivitis. Perennial means throughout the year it will be. So perennial. So perennial allergens like house dust, animal dander, mites. Okay, onset here also it is subacute in onset. Sometimes it is chronic in nature. Coming to pathology, what is the pathology? We have three stages. One is vascular. Vascular changes will be sudden and extreme vasodilatation will occur. So due to vasodilatation, there will be increased endothelial gaps, which leads to increased permeability of the conjunctival vessels. And in inflammation, we heard of first stage is vasodilatation. We heard, right? Same here. So there is a formation of exudate. Okay, coming to second one. So cellular stage may conjunctival infiltration and exudation here also. So in that exudate we have large portions of eosinophils, plasma cells and mast cells. Coming to conjunctival will have swelling of conjunctiva. Okay, swelling or chemosis of conjunctiva and increased connective tissue formation, and we have papillary hyperplasia. Coming to clinical features, symptoms will be itching, burning sensation and watery mucus. Okay, we have means itching and burning sensation are associated with watery mucus and stringy discharge and mild photophobia. What are the signs we elicit? We elicit hyperemia, increased blood flow to the conjunctiva, chemosis, swollen juicy appearance of the conjunctiva, mild papillary reaction on palpebral conjunctiva. And we have edema of lids. Okay, what is diagnosis? Diagnosis will be made based on typical signs and symptoms. Okay, and we will have abundant eosinophils in the discharge. So treatment will be, you should avoid exposure to the allergen triggers. Okay, and for seasonal allergic conjunctivitis, we should not go outdoors. We should stay indoors so that we might escape from the risk of getting allergy from the pollens or something. Coming to perennial allergic conjunctivitis, we should cover the beddings with plastic cars, remove carpets and pets. We should avoid the pets. Cold compression we should do for reducing the swelling. Okay. Now coming to next treatment is carboxymethyl cellulose eye drops, which are they induce artificial tears. Okay, coming to vasoconstrictors we should give, because we said hyperemia, increased blood pooling to the conjunctiva, so we should reduce that congestion. So we are using decongestors, okay, which are vasoconstrictors. They are nafazoline, antizoline and tetrahydrozoline. And mast cell stabilizers we should use. They are sodium chromoglycate and nedochromin sodium. Dual action antihistamines, mast cell stabilizers should be used. Example, azelastine, olopatadine and ketotifen. NSAIDs we should use for reducing the pain. They are ketorolac. What do NSAIDs do? They inhibit the cyclic oxygenase, thereby inhibiting the arachidonic acid. They will inhibit arachidonic acid synthesis pathway, cyclic oxygenase inhibition leading to prostaglandin synthesis inhibition. Okay. So steroid eye drops whenever necessary only. If in case of urgency, emergency only, we should give steroid eye drops. Otherwise, there leads to immunosuppression. Okay. Coming to systemic antihistaminic drugs. That's it. Simple allergic conjunctivitis. Thank you. In next video, we'll talk about vernal keratoconjunctivitis, which is very important.